Hi there. Today's topic is Mycoplasma pneumonia. You've probably been seeing in the news, or if you haven't, newsflash, we're going through quite a bit of mycoplasma right now, especially in kids around the country. I've seen several cases of it myself, including in my own house, so I thought it would be a timely topic to cover. Mycoplasma, or other atypicals, which are in the same class, generally cause around 2 million cases of pneumonia each year in the United States. We often don't test people for these because they don't get sick enough to be in a hospital setting where we would really need to test their sputum or the stuff that they're coughing up for the causative organism. Numbers were down significantly during the pandemic when COVID walked in and said, "Here, everything else, hold my beer." But the numbers have been on the rise again of late. Mycoplasma has a particular affinity for the epithelial cells of the respiratory tract, which is why we'll see it in the throat and the airways. That's why it causes problems there. It actually damages those cells. So when someone starts coughing from this, they might get better and not be sick anymore after days, but they might still cough for 3 weeks afterwards.
Ain't nobody got time for that.
So there's a lot of reassurance that I have to do with my patients and parents of patients, telling them they're going to be okay as long as they are not acting sick and not struggling to breathe. Don't worry too much about it at that point. The incubation period of mycoplasma is generally anywhere from 1 to 4 weeks, so that's a huge incubation period. If you've been exposed to somebody with mycoplasma, then just be on the lookout for developing a cold, bronchitis. If it proceeds to anything more than that, you may need antibiotics. It's good to know if you've been around with somebody that had this, because that can help your doctor figure out what's best for you. Many times this just resolves on its own, but when cases proceed to the pneumonia phase, that's when we generally get to the antibiotic treatment. Usually people who have mycoplasma pneumonia have what we would consider an atypical pneumonia. It's also called walking pneumonia in a lot of cases. And walking pneumonia just means it's a milder case. You're not sick enough to need hospitalization, or it is in an ambulatory setting, meaning people are walking around. It's also one of the main causes of community-acquired pneumonia. So all of those basically mean the same thing, but if you get to the point where you have pneumonia, you're going to be on an antibiotic. Interestingly, when you examine somebody who has mycoplasma, especially during the early part of their pneumonia, their chest exam, meaning when you are auscultating or listening to their lungs, you won't hear a thing. Normally, when I see somebody who has pneumonia, I can hear it very well in one area of their lungs, or one lung field is what we call it, and it will have a sound that we call rhonchi that sounds like snoring. And mycoplasma, you hear nothing. The chest x-ray also looks very different. It doesn't have what we would call a consolidation, or one lung of the lobe that just turns white. It's kind of widespread in there. And on the chest x-ray, we don't have the typical presentation of one lobe of the lung that's whited out. It's more widespread than that in what they would consider an atypical pattern, thus giving it one of its names. For my science nerds out there, mycoplasma doesn't have a cell wall, and so when we're choosing antibiotics, we usually go to a macrolide, or one of the mycin family, because beta-lactams work on the cell wall synthesis of a bacteria. So if you were to put somebody with mycoplasma on amoxicillin, you wouldn't notice any difference because it's not actually going to kill it. Also, due to lack of the cell wall, it won't show up on a gram stain, which is one of the ways that we test sputum to see what is in there. We'll stain it and see if it's gram positive or gram negative. This doesn't help us out there. Thankfully, mycoplasma pneumonia is rarely life-threatening. It can cause a cough that lasts for weeks afterwards. The antibiotics help people feel better, but it doesn't repair the damage to the airway. That just has to happen over time. So don't get too down on yourself. I promise it'll get better. In more severe cases, people can develop a rash, they can develop hepatitis, sometimes jaundice, They can have mucocutaneous syndrome, which means different things happen with the mucous membranes and the skin or the cutaneous area. And it can be a severe S. Stevens-Johnson syndrome. So we don't want to ignore it, but hopefully we can catch it before it gets to those bad stages. So if you see somebody coughing their head off, maybe steer clear if you can. Or if you still have your COVID masks laying around, grab those if you're going to have to be around them for a while. Take care of yourself. And don't forget to like and subscribe and stay tuned for more.